Welcome to NCLEX Map, your go-to resource for mastering clinical judgment at the bedside. Today, we'll walk through a complete head-to-toe assessment on adult client, blending precision with clear communication. Let's dive in. Start every assessment by washing your hands and verifying 2 patient identifiers. Always confirm any allergies before proceeding. Ensure privacy, proper lighting, and raise the bed to a safe height. Safety, communication, and trust are key. Hi, I'm your nurse today. I'll be performing a full assessment. Is this a good time for you? Now, take a moment to observe the patient's general appearance. Do they look comfortable or in distress? Check their airway, breathing, and circulation. The ABCs. Is their airway clear? Are their breaths even? This first glance can reveal more than any single vital sign. Next, let's assess the neurological system. Ask simple questions. Can you tell me your name and where you are? Check their level of consciousness and pupil response. Pupils should be equal, round, and reactive to light. Assess motor strength. Squeeze my fingers, push your feet down. Now pull them up. Look for symmetry and any signs of weakness or tremors. If confusion arises, use a validated delirium screening tool. These signs can indicate serious issues. Never overlook them. Next, always ask, "Are you in pain right now?" Use a pain scale to document location and intensity. Pain impacts everything, from mobility to healing. Now, let's inspect the head and scalp for any abnormalities. Check the eyes for redness and pupil reaction. Look at the mouth for hydration indicators. Listen to their speech. Slurred or hoarse can signal problems. Inspect the nose for any issues and assess hearing if needed. Gently move to the neck and check for trachea alignment. Observe for jugular venous distension, especially in heart failure patients. Palpate carotid pulses one at a time and auscultate for bruits. Always prioritize safety and comfort. Now, observe the chest wall for symmetry. Count the respiratory rate and note effort and rhythm. Auscultate anteriorly and posteriorly, comparing both sides. You should hear clear breath sounds throughout. Document any abnormal sounds and respond to distress promptly. Next, let's assess the heart. Inspect the precordium and palpate the point of maximal impulse. Auscultate over all 4 cardiac areas: aortic, pulmonic, tricuspid, and mitral. Listen for extra heart sounds or murmurs and document them. Check capillary refill and pulse regularity. Now, assess the extremities for pulses and any color changes. Inspect for edema or ulcers and ask about numbness. Document neurovascular checks carefully every time. Next, let's move to the abdomen. Ask about any nausea or changes in bowel habits. Ensure the patient is lying flat with knees slightly bent. Inspect for scars or distension before auscultating. Normal bowel sounds occur every 5 to 20 seconds. If absent, listen for a full 5 minutes before proceeding. Percuss for tympany and palpate gently for tenderness. Ask about their last bowel movement. It's key for GI function. Now, let's check the genitourinary system. Ask about urination. Any pain or difficulty? Observe urine color and clarity, and check for infection signs if a catheter is present. Next, observe posture and movement for musculoskeletal assessment. Ask the patient to lift arms and flex wrists. Check range of motion and assess gait if safe. Encourage mobility to prevent complications. Now, perform a systematic skin assessment from scalp to heels. Inspect for color, temperature, and moisture. Note any bruises or pressure points, especially over bony areas. Trace every IV line and check for correct fluid and securement. Ensure oxygen tubing and devices are applied safely. Before finishing, ensure safety. Lock the bed and place the call bell within reach. Reassess comfort and pain before you leave. Thank the patient for their time and explain the next steps clearly. Clean your hands again before exiting the room. Finally, Document everything accurately using the S-bar format. Effective communication saves lives. Be alert for red flags like confusion or respiratory distress. Never delay escalation when something doesn't look right. A thorough assessment is the foundation of clinical judgment and safe care. Thank you for learning with NCLEX Map, where nursing knowledge becomes confident action.